Hi, my name is Peterson, and I'm presenting the lymphatic system. The lymphatic system is made up of a structure. The structure is made up of nodes, vessels, capillaries, and organs. The lymph vessels and lymph capillaries carry a fluid, which is called lymph. Lymph is a clear yellow substance that carries disease-fighting cells, such as this. It's a fluid. Lymph nodes are located throughout the body. As you can see, it's all located throughout the whole body. The main organs of the lymph system include bone marrow, thymus, lymph nodes, spleen, tonsils, lymph tissue in the bowels, somewhere over here, and other mucous membranes in the body. I'm missing some of my lymphatic system, my tonsils. Next, we're going to the normal function of the body, of the lymphatic system. Collect and recycle fluid. To collect and recycle excess fluid and it dissolves substances. It removes excess fluid and waste products from the body tissues. Next, to absorb fats. To absorb fats and other substances from the digestive tract. So it keeps it from entering your digestive tract. And 3, coordinate immune response. To coordinate an immune response to remove cellular debris, bacteria, toxins, fungal, and viruses that accumulate in our bodies to help our immune system fight the bacteria, as you can see. 3. Next, we have our risk factors. First off, not enough sleep, decreased sleep, or we like to call lack of sleep. Next, we have poor nutrition, which you can eat a lot of these and it's not the best for you. So I would say more veggies and apples and fruit. So next you have chronic illnesses, which isn't cute, but we like healthy people. So we hope no one ends up like this. So we try to get that. And next that leads to it is stress. Stress leads to one of the factors. So try to avoid all of these things. Next off, we got age-related changes. First off, immune weakness. Immune system weakness increases the risk of infection, types of infections. So the infections we don't want are the chronic illnesses like I showed you in the last slide. And yeah, just don't let your immune system get weakened. B, the lymph nodes decrease. It takes longer for a person to recover from an illness, so you have less lymph nodes, which is not good. And C, longer illness recovery time. The number of size of lymph nodes decrease, which results in the body being less able to contract a fever to fight the infection. So when you have less lymph nodes, it takes your body more time to recover from the lymph node, like from the illness that you have. And D, decrease vaccine response. Response to vaccines decreases. So the more vaccines you get, the less they respond to, because your body is just going around it. Which it also means the body doesn't build as good of immunity to the vaccine. So the more vaccines you get, the less immunity you get at this point. Common disorders right here are lymph nodes enlargement. This is a swollen lymph node, and that's a normal sized lymph node. So obviously you can get very swollen lymph nodes on the side of your neck that look like this, but we want them to be that. Next, we have lymph node blockages, which when a lymph node gets blocked, you can get elephantitis, which is horrendous. You never want that. There's two different pictures of this. It's when the lymph node gets blocked. Next, we have lymph node cancer, is when the cells, it's out of control cells. They're out of control. So that's what lymph node cancer is. And reoccurring infections, which is tonsillitis, which that is what I had when I got my tonsils removed. Not good. It just is a reoccurring infection in a body part. Most of the time, the lymphatic system. Important information is our next step, and what you should know is important information for nursing assistants to know is in caring for a person with disorders is to know how to prevent them from infection by doing hand hygiene and washing their hands often. They should make sure the resident has a clean environment always, so that they're not in feces or so they're not as high of risk because they're having a clean environment. They should have the resident have good nutrition and fluid intake. They might have a slight fever to help them fight the infection, like some people do when you get a fever. The NA should measure vital signs accurately. It's important that the NA knows that the resident is at high risk of getting infections. So the elderly are more at high risk of getting infections like the lymphatic system infections because they're more at high risk. I hope everyone has enjoyed learning about the lymphatic system as much as I have. I look forward to all of your feedback.